Good afternoon. My name is Jim Pinciotti, and this is Merit Spear. Together, we have the privilege of leading the ALS Association here in the Commonwealth of Pennsylvania. For those of you who may not be aware, ALS is also known as Lou Gehrig's disease. It's a fatal neuromuscular disease that affects people without regard to age, religion, gender, or anything else. It is a difficult disease to live with, and we have some very brave souls here today who are doing just that, living with ALS. The reason we're here is because May is ALS Awareness Month, and we are proud to help the folks living in the Commonwealth of Pennsylvania and their families through the journey with ALS. It is truly my pleasure to introduce to you a gentleman who is currently living with ALS, Mr. Neil Alexander. Neil?
Thank you. My name is Neil Alexander. I'm from the Pittsburgh area. I have a beautiful wife, 2 amazing kids. In June of this last year, I was diagnosed with ALS, and I was told that I have 2 to 5 years to live. Now, I'm not here to talk to you about my situation. I'm fortunate to have a fairly robust employee benefit package that's going to help me and my family manage this disease. However, there are many people in our Commonwealth that do not have access to the proper products and services to help them manage the disease, and historically they have gone to the ALS Association for those services. Up until last year, the Commonwealth provided funding to the ALS Association. This past year, it dropped to 0. Those people in our Commonwealth that need those products and services, they are at some point going to descend on all the other state agencies for their services. So I would like to make the business case for additional funding this year from the state. We're asking for $800,000. In the scheme of things, that's a fairly modest amount of money. And if we receive that, the ALS Association receives that money up front, they're going to save a significant, the state is going to save a significant amount of money on the back end. So I could tell you the emotional case for this, that there are people living in our state that need our help. I'm going to eventually lose the use of my hands, my arms, the ability to walk, the ability to speak, the ability to swallow, eat, and eventually the ability to breathe. I'm going to need the help of my children to feed me, bathe me, dress me. My wife is going to have to help me go to the bathroom. It's a pretty dark and serious situation. Although I could make that argument, and I think it would resonate with most people, I think the business case in tough budgetary times, if we're able to be allocated money up front, we can save the state a significant amount of money on the back end. I think we owe it to all of the people living with ALS in Pennsylvania. Thank you.
Good afternoon. In 2010, the legislature approved $325,000 for ALS Patient Services. Unfortunately, many of those services were cut in the last budget, and many ALS patients were left having to wait for the economy to improve in order to restore funding. But people with ALS can't wait. They don't have the luxury of time. To someone with ALS, every need is an urgent need. Every moment is a precious one. For the ALS Association, every dollar is precious as well. Through our loan closets, we make sure that people with ALS not only get the devices they need now, but we also prepare them with the tools they'll need as their disease progresses. In fact, each dollar invested in the ALS Association is not only an investment in patient care today, it's an investment in the future. With the help of the in-home care programs for ALS patients, family caregivers are able to continue working, providing a stable income to make sure they maintain a reasonable quality of life. Through investments in assistive technology, many ALS patients are also able to continue working themselves. That saves employers money in training new employees, keeping smart workers in the right position, and helping families continue to live on a stable income source. Through our investments in multidisciplinary clinics, we ensure that ALS patients meet with multiple specialists who cover a variety of needs. We also help prepare patients for home renovations, proper wheelchairs, and with all the tools they'll need to live freer and better quality of life. By investing in these programs, the ALS Association helps people with Lou Gehrig's disease stay in their homes. Husbands stay with wives, wives stay with husbands, and parents get to see their children each day, a daily human reality that simply can't be measured in dollars. We also make sure that people with ALS aren't forced into living into nursing facilities. Again, that's something you can't put a price tag on. That being said, every person with ALS that we can help stay in their home saves the states tens of thousands of dollars each year. But in fact, it's easy to make the case as purely economic terms. But as our friend Bryan Cutler will tell you, facts and figures don't change hearts and minds. The personal stories of the people here with us today and the more than 800 people with ALS across Pennsylvania who are counting on us are what will ultimately decide if supporting ALS patients' service is a priority in this year's budget. We need you to tell your stories and make your voices heard. In that connection, I'm proud to introduce two wonderful people from Bloomsburg whose stories are making a difference, Rosa Snyder and Mandy Podehl. They know firsthand why funding for people with ALS makes more than just fiscal sense. It's just the right thing to do and the right thing to do now. Rosa and Mandy.
Within the next 90 minutes, someone is going to die of ALS. Every 90 minutes. This is a shocking fact I knew nothing about before 2010. Hello, my name is Rosa Snyder, and this is my friend Mandy Podell. Tragically, we met because our loved ones shared the same fate. We are here today because we know other families are struggling with ALS, and we want to help them. Late 2008, my dad, Jorge, started to experience weakness in his arm. He was diagnosed with ALS in April 2009 and passed away only 9 months later. It was a struggle that I would not want any family to have to endure. I live in the Bloomsburg area. Where I live and in most rural communities, ALS is not even known or talked about. It is a great community, but when you find out that someone you love has ALS, you feel very alone. I can't. I didn't know anyone who had this disease. The ALS Association provided my dad with a hospital bed, a wheelchair, and other incredible services that made his life easier. But more than that, they made me feel like I was not alone in this fight. I started the Bloomsburg Jorge's Walk to Defeat ALS because of my dad. I remember my dad wanting to go to a walk or support group because he didn't know anything about this disease. He didn't know what to expect. By raising money and awareness, we now have both in Bloomsburg area. But this does very little to cure the disease. It is my unending belief that together we can cure this disease. That's what brings my friend Mandy and I here today.
just want to say thank you, Rosa, and thank you for everybody for being here today. My name is Mandy Podehl, and I am here because ALS took my brother. In the spring of 2007, my brother Dustin graduated from Bloomsburg University. He was the first member of our family of 7 to graduate from college, so you can imagine how proud we all were of him. And sadly, just 3 years later, he would pass away from ALS. Dustin started to feel his left arm dragging when he was exercising in 2008, and his problems got worse over the next few months. His first neurologist told us there was a possibility that this was ALS, and he referred us to the University of Pennsylvania Hospital's neurology department in Philadelphia. It was difficult to get a confirmed diagnosis for Dustin because he was so young. And over the next year, we saw more specialists as his condition worsened. He began to limp, and he started to struggle to breathe and was eventually put on a BiPAP machine. And in December of 2009, we got the official diagnosis that this was definitely ALS. During my brother's illness, I was his point person. I was responsible for scheduling everything related to his care, his doctor's visits, his outings, his home visits, his friends coming over, and the seemingly endless paperwork that patients with this disease are faced with. It was the most overwhelming job that I have ever tried to take on. A few weeks after his diagnosis in December, we had our first ALS clinic appointment at the University of Pennsylvania. This day was my saving grace. Every possible doctor, therapist, specialists, nurses, social workers, all in one place at the same time. It was the most overwhelming and grateful day that my family and I had had since Dustin's symptoms started. All of a sudden, we had a team of professional allies on our side, and we knew we wouldn't be alone in this fight. Less than 6 months after Dustin's diagnosis, he passed away. On May 1st, 2010, it's exactly 2 years ago today. I don't think I could be in a better spot than I am right now. He was only 26 years old. Being part of the ALS Association helped us know that we weren't alone in this fight, and the services that the association provides are extremely important to families like mine and Rosa's. Both of us lost somebody we loved far too quickly, but there are hundreds of other families across this state that are just like ours. We are not alone in Bloomsburg, and we're not alone in Harrisburg. Thankfully, we have a champion in Representative Bryan Cutler, who is a voice for ALS families in the legislature. Thank you, Bryan, for being there for us and the over 800 other families that ALS Association helps every day in Pennsylvania.
We need to make sure that Bryan is not alone. We need the House and the Senate and the governor to join Bryan and all of us in supporting these services to help ALS families. Please join us in recognizing Bryan's efforts.
I want to thank all of you for coming up here because this is why I do it. This is why I advocate on behalf of ALS, because it's so important that we as policymakers understand that ALS patients simply don't have the time for partisan bickering. They don't have the time to wait for the next budget cycle. There's hundreds of families in the Commonwealth that could be touched, and the economical reasons are great because if we don't fix this, the truth is many of these individuals will end up needing state assistance, being put in institutions, and needing further help. And I know personally from having cared for both of my parents, it's far better to care for an individual at home, both on an emotional level as well as on a physical level, because that is the area where we're all comfortable. That is where everyone wants to be. And on top of that, it makes good, strong financial sense. So I appreciate it. It's an honor, and I'll certainly look forward to still making the rounds with all of you. So thank you.
I just want to add my thanks to Representative Cutler for helping cover all the bases in this fight against ALS. Thank you all for being here. Thank you to our advocates for being here. We are making a difference. Have a great day.